Myopia or short-sightedness is a type of refractive error where parallel rays of light coming from infinity or focus in front of retina when accommodation is at rest. So etiological classification of myopia are axial myopia, curvatural myopia, positional myopia, index myopia. So axial myopia is because of increase in the anteroposterior length of your eyeball. Curvatural myopia is because of increase in curvature of cornea or lens, or it can be because of both. Index myopia is because of increase in refractive index of your lens. Positional myopia is when you have an anterior displacement of your lens. So it is because of your anterior placement of your lens. Now clinically, how can you classify myopia? So the clinical types of myopia are congenital myopia, simple or developmental or school myopia, pathological or degenerative myopia, acquired myopia. Congenital myopia, as the name suggests, it is present since birth, but it is most visible at the age of 2 to 3 years. Simple or developmental or school myopia. So with this simple or developmental or school myopia, usually it is seen in children going to school at the age of 8 to 12 years. So school going children. So therefore it is also called as school myopia. So the etiology includes almost the same what we discussed in the previous slide, but in addition, the role of diet, the role of genetics have got some role to play in this. Apart from these two, when a child is trained more to use only the near vision, then that can also cause the simple or school myopia or developmental myopia. Now next, moving on to pathological or degenerative myopia. So this type of myopia happens whenever there is going to be a rapid growth of your eyeball. So when there is a rapid growth of eyeball, so this can cause pathological or degenerative myopia. So this again can be because of heredity, and it can also be because of the general growth process, which is going to trigger the growth of the axial eyeball. Now moving on to acquired. So the acquired myopia can be there post-traumatic, or it can develop post-keratitis. So this is called as acquired myopia. Now what are the symptoms a person can present with? So a person can have a defective distant vision. They can have asthenopic symptoms. This is mainly because of usage of your accommodation in excess. So symptoms that are present because of this are tiredness of eyes, frontal headache, watering of eyes, photophobia. They can also have half shunting of eyes. So these symptoms are seen in your simple myopia. In pathological myopia, in addition to all, you can also see night blindness and muscae volitantis. So what is muscae volitantis? So this is nothing but the person will be complaining of floating black opacities in front of eyes. So that is called as muscae volitantis. So what are the signs you can see? So first, they can have prominent eyeballs. They can have deeper anterior chamber. Pupils look big and sluggishly reacting. Fundus examination is normal. So this are seen especially in simple myopia. But whereas in pathological myopia, fundus examination will reveal large and pale optic disc and myopic crescent can be seen. Degenerative changes can be seen in retina and choroid, and characteristic Foster-Fuchs spots are seen at macula. So what are Foster-Fuchs spot? So these are dark red circular patches which is due to subretinal neovascularization and choroidal hemorrhage. So that is what is seen as Foster-Fuchs spots, which can be seen at medulla. Posterior staphyloma is mainly because of ectasia of your sclera at posterior pole. So that is called as posterior staphyloma. There can be degenerative changes in vitreous. Vis reflex is where you have the posterior vitreous detachment. So if there is posterior vitreous detachment, you call it as the vis reflex. That is also seen in pathological myopia, in addition to vitreous liquefaction and vitreous opacities. Complications are mainly retinal detachment, complicated cataract, and there can be vitreous hemorrhage or choroidal hemorrhage. How can you treat this condition? By concave lenses, radial keratotomy, photorefractive keratectomy, LASIK, intraocular contact lens, intercorneal ring implantation, and orthokeratology. Now moving on to MCQ. Foster-Fuchs spot is located at which part of your eye? Cornea, optic disc, macula, peripheral retina. So in the previous slide we discussed that Foster-Fuchs spot are seen in macula, which are nothing but dark red circular patch due to subretinal neovascularization and also choroidal hemorrhage. So your answer is macula.